day everyone, my name is Junamisi Untowa, a student nurse from Davao Doctors College, and today I will going to perform Leopol'S maneuver return demonstration. Leopol'S maneuver is used to systematically palpate the gravid uterus. It is an easy to perform non-invasive method to determine the position, presentation, and engagement of the fetus inside the uterus. Leopol'S maneuver is done after 30 weeks gestation to help the expectant mother and the healthcare provider be better prepared for the labor, and it also helps in determining if it is much easier to perform cesarean section. Prior to the conduct of the procedure, I have prepared the necessary equipment such as towel, pillow, and my stethoscope. Next, I already done doing a hand washing. It is to protect my patient and myself as well from the infections. Good day, ma'am. My name is Junimisi Untowa, your student nurse for today. Can I see your wristband, please? Can you state your full name? And what do you want me to call you? Okay, ma'am, today I'll be going to perform Leopol'S maneuver, which involves my hands in your abdomen and carefully identifying specific fetus, okay? So this process allows me to gather information about the baby's position within your uterus, contributing to a safe and healthy delivery process. So is it okay with you? So before we will doing the procedure, can you empty your bladder, please? Okay, so that's good. So emptying the bladder beforehand enhances the accuracy of assessment by minimizing the potential interferences or discomfort of a full bladder. This ensures clear evaluation of fetal position and presentation. So to begin, I will position you on your back with your pillow under your head and your knees slightly flexed. So this position optimizes abdominal muscle relaxation, provides improved visualization and palpation of fetal landmarks, and also prioritize the comfort of my client, which in turn facilitates a more precise assessment of fetal position and presentation. So since that I am right-handed, I will stand to your right facing you, and this position offers easier access for palpating fetal position and allow for smoother execution of the assessment techniques. So placing me on your right ensures that my dominant hand is in a position for accurate palpation and communication with you, okay? So Leopol'S maneuver comprise 4 distinct palpation steps of fetal position in the uterus. So let's begin with the first maneuver. So I'm going to face the patient and palpate for the uterine fundus that is located somewhere upper in the abdomen, and determine which part of the fetus occupies the upper region of the uterus. Ma'am, I will going to show your abdomen. So during the first maneuver, if the baby is in longitudinal line bridge position or presentation, we will typically feel the firm rounded head of the fetus, and in the case of transverse line shoulder presentation, this maneuver might reveal a broader irregular mass presenting the baby's shoulder. So now we're going to move on in the second maneuver, where are the umbilical grip. So subsequently, we will gently apply pressure in the downward direction and the size of the abdomen, assessing the position of the fetal extremities, the fetal back, and the anterior shoulder. So in the second maneuver, if the baby is in longitudinal line bridge position, we will typically sense the baby's back along the side of the mother's abdomen, and the back feels firm and continuous. So now, the next maneuver, which is the third one. Moving on, I will place one hand over the surfaces and grasp the lower uterus segment between my thumb and fingers to identify the presenting part of the fetus. So this maneuver allow us to assess the confirm of the fetus presenting part. Then, subsequently, we're going to do the last maneuver. We're going now to turn and face the feet of our client and verifying the findings from the third maneuver of the vertex. Okay, so this step helps us to determine the side of the abdomen where the baby's back is the situated and the positioning of the baby's limbs. So lastly, I will again locate the baby's back and position the stethoscope over it and listening for the fetal heart tones for a full minute. So in this procedure, I will use the bell of the stethoscope. So it is important to note the location rate and the characters of the fetal heart tone. So fetal heart tone is in between 110 to 160 beats per minute and may vary depending on the gestational age of the fetus and baby's activity inside the mother's womb. So upon completing a procedure, I will position my client in a comfortable position. Are you okay in that position po? So after that, I'm going to document all the observation including fetal presentation, position, attitude, and engagement or floating of the fetus. So ma'am, thank you for your cooperation. If you have any question, you can ask me. You have any question? Okay. So this is how you perform the Leopol'S maneuver.